Hello and welcome to Right Parenting Tips. Today's topic is COVID-19 in children and teens. In COVID-19 pandemic, children below 18 years of age constitute only about 15 to 20% of new cases and are likely to be either with no symptoms or with minor illness. The severe or complicated cases and deaths are uncommon. This picture may change with the newer waves of COVID-19, and the cases in the children and the teens may start increasing, both in number as well as severity. COVID-19 cases in children and teens share many similarities with adult cases. The incubation period is similar, which is 2 to 14 days with average of 6 days. Their overall symptoms, virus loads in nose and throat, rates of secondary infections and rates of spreading infection to others are also similar. COVID-19 in children can present with general symptoms like fever, fatigue, headache, muscle pains, loss of appetite, poor feeding, loss of taste or loss of smell. Respiratory symptoms like cough, sore throat, and runny or blocked nose, and gastrointestinal symptoms like nausea, vomiting, diarrhea and abdominal pain also can be there. Danger signs in COVID-19 are persistent fever, persistent cough, breathing difficulty, chest pain or tightness, severe gastrointestinal symptoms, confusion, drowsiness, bluish or pale gray discoloration of lips or nail beds. Multisystem inflammatory syndrome in children is an important complication of COVID-19. It comprises of fever, lab evidence of inflammation and involvement of 2 or more major systems or organs in a child with active or recent COVID-19 infection, or exposure to a COVID-19 case within last 4 weeks. This syndrome presents with persistent fever, abdominal pain, vomiting, diarrhea, skin rash, red eyes, redness or swelling of mouth or lips, redness or swelling of hands or feet, headache, dizziness, lightheadedness, fast heartbeat and rapid breathing. Children who are at high risk for severe COVID-19 are children younger than 1 year, and children with complex or chronic medical conditions such as genetic, developmental or metabolic conditions, chronic diseases such as asthma, diabetes, hypertension, obesity, chronic heart, lung, kidney or neurologic conditions, certain hematologic conditions, or immunosuppressed states. Treatment of COVID-19 in children and teens depends upon severity of infection. Mild to moderate cases can be treated at home symptomatically with analgesic antipyretics, saline gargles, saline nose drops and adequate fluid intake. Severe cases may require hospitalization, oxygen supplementation and assisted ventilation. Antiviral medicines, immunomodulators, steroids and anticoagulants may be used on case-by-case basis as per country or center-specific protocols. Hand washing, social distancing, no-touch greetings, face mask in children over 5 years, avoiding unessential outings, gatherings or travels, and vaccination are important preventive measures. Currently only Pfizer vaccine is approved for 12 to 18 years of ages. Trials are on for vaccines for younger age group children.